Hello, my name is Angela Trainer and I'm a clinical hypnotherapist and director at the Harvest Clinic in Glasgow. I'm also Principal Scotland of the London College of Clinical Hypnosis Training Student Hypnotherapists. I'm here today on the bonny banks of the River Clyde to interview Dr Michael Yapko, world-renowned psychotherapist and family therapist all the way from sunny California. Dr Yapko is speaking at the 23rd World Congress on Psychosomatic Medicine. Welcome to Glasgow, Dr Yapko. So Michael, can you tell us some of what you'll be sharing at this Congress?
At this conference, I just have a brief presentation where I'm really going to give people an overview of what the potentials are of hypnosis. So many people here don't really have any background or training in it. People who have asked me privately, what's the relevance of hypnosis to psychosomatic medicine? So I'm really providing, I think, a basic understanding of how hypnosis influences physiological processes. I'm actually going to be showing a couple of brief video clips that I think are pretty impressive displays of the mind-body relationship and the use of suggestion to create some pretty significant responses. One is a young girl who has had a stroke and lost the use of her right hand and arm, and so it has become very twisted and unavailable to her. And one of my students, Ron Bishop, did a session with her, and you literally watch her arm unfurl and she starts to use her fingers again. And when I have a follow-up, even just a month later, she's able to demonstrate control over her hand, which is amazing. So things like that.
And do you find that doctors are quite receptive to this kind of information when it's presented to them?
Here you have a biased collection of doctors who are into psychosomatic medicine, so they understand that you can't just treat a body, that you have to really treat the whole person. So philosophically, they're already there. They just haven't had the exposure to hypnosis. They haven't had the exposure to credible people talking about hypnosis, people who understand enough of the science to speak their language. And once they encounter somebody like that, I find them very receptive.
That's wonderful. So this is the way forward.
Yeah, it is the way forward.
You're doing a workshop for us on Sunday up at the university in Glasgow.
Yes.
Depression and health beyond the medical model. Can you tell us a bit about what that means?
Yeah, unfortunately, the majority of people who receive treatment for depression receive antidepressant medications. They're being treated as if depression is a disease and the medication is somehow going to provide the cure. And it's a terribly distorted view of depression. And certainly we've had enough evidence over the last 5 years especially that antidepressants are not nearly as safe and effective as people have been led to believe. The drug companies have literally been caught in flat-out lies about the merits of the antidepressants, so much so that the NHS, in fact, has decided they're not going to prescribe antidepressants at all, except in the most severe of cases. And so to provide another viewpoint of depression, a more socially based viewpoint, one that says depression is much more a product of social forces than it is a disease. And so looking at depression from a much broader perspective is what I'll be talking about tomorrow, and specifically about the role of hypnosis in the treatment process. That when people learn specific skills that are known to reduce and even prevent depression, they do better, obviously. And so hypnosis has a pretty strong role to play in that process, and I'll be describing that tomorrow, and I'll be showing that tomorrow. I'm going to show a video.
Drugs alone, or even drugs per se, are not the solution.
No,
you
not even
actually
close.
Go further. You say depression is contagious.
Yes.
Can you explain that?
Yeah, what I mean when I say depression is contagious, and that was actually the title of my last book about depression, is that depression is socially defined, depression is socially transmitted, that so many of the risk factors that lead people to become depressed arise in the social arena through hurtful relationships, people who hurt us, they betray us, they reject us, they humiliate us, they die, all the losses and hurts that go along with social relationships. But more than that, the factors that make people vulnerable to depression are socially acquired. It's the things that you don't learn about problem solving. It's the things that you don't learn about effective coping. It's the things that are modeled for you or are not modeled for you that as you're growing up that increase or decrease your vulnerability to depression.
You didn't actually get the chance to meet the late great Milton Erickson, but what do you feel was the most significant contribution he made to the world of hypnosis and hypnotherapy?
I think that the most significant thing was redefining hypnosis as a social phenomenon as opposed to an intrapersonal phenomenon. Up until that time, hypnosis was viewed as something only within the person, and they either had the hypnotic ability or they didn't have the hypnotic ability, and that's how the whole field of hypnotizability testing evolved to determine, does this person have the ability, and if so, to what degree. Erickson viewed hypnosis very much as a product of an interaction, and he was fully willing and able to take responsibility for initiating and directing how that interaction went, how to use himself to elicit the resources from the client. And that was a very different perspective, and in many quarters still remains a very different perspective. There are lots of traditional practitioners who still think of hypnosis as only within the person.
And that's not something you would be in line with?
No. I mean, certainly we know that people differ in their hypnotic abilities. There's nothing new about that observation. Nobody argues that point. What people do argue about is what the significance is of that point. The big questions of why do people differ in their hypnotic abilities? How do they differ in their hypnotic abilities? What gives rise to the differences in hypnotic abilities? But even when you have someone who is considered a relatively low hypnotizable, so-called low hypnotizable, that doesn't say anything about how they're going to respond in treatment. And I think that's, for me, why the use of testing has never really been much of an attraction. That the tests reveal how they respond to a test score or a test protocol, but it doesn't really say anything about how they're going to respond to a therapeutic intervention using hypnosis, where the motivations are totally different, the investment is totally different.
So you would agree then that I do a lot of work with women with childhood trauma and sexual abuse, that in fact these hypnotizability tests can get in the way of rapport and relationship?
I think so.
Can be on a loser from the start.
I think so. I think that any time that you use a test and give somebody a score, you're in essence creating artificial boundaries that help define what they can do, and it influences their response to treatment, and it influences your expectations of what you can expect from this person. So I would ultimately much prefer that if you want to know how somebody's going to do with hypnosis, do hypnosis with them.
Now, in your book, Treating Depression with Hypnosis, you say that psychotherapy has always been primarily art, not science. Can you expand on that for us?
Yeah, sure. You know, over the last 30 years especially, psychotherapy has been subjected to a great deal of analysis, a great deal of research. The big question, does psychotherapy even work, which people are still arguing about. And so trying to make psychotherapy a science, trying to make it something that is protocol bound, predictable, measurable, has been a goal for many people, and trying to develop what are called the so-called empirically supported treatments. And that's an interesting thing to do, and it's a valuable thing to do, and it's certainly something I would continue to encourage. On the other hand, it isn't the therapy that treats the patient. It's the therapist using the therapy that treats the patient. And personally, I would much rather that we have empirically supported therapists than empirically supported therapies. That one great therapist can have a tremendous influence on many people, just as one really mediocre therapist can have a negative influence on so many people, regardless of whatever therapy they happen to be practicing. It's about clinical judgment, it's about experience, it's about being able to know what to say when. And that isn't something you're going to get out of a manual.
Yeah. Now, I train students for the London College of Clinical Hypnosis and the University of West London who run an MSc degree programme in clinical hypnotherapy. What advice would you give to trainee hypnotherapists starting out on their journey today?
Well, I think there are lots of pieces of advice. I think number one is to become very familiar with the literature. The scientific literature of hypnosis is very broad and very deep and provides a great deal of foundation to understanding what this phenomenon of hypnosis really is. But beyond that, you know, the hypnosis is just part of a much larger picture. And it's really one of the differences between the UK and other places like America, where we really don't use the term hypnotherapy because it doesn't say anything. It suggests that the hypnosis is the therapy, but meanwhile you have this person who does hypnotherapy and you have this person who does hypnotherapy, and they're doing virtually opposite things. And so I think that it would be useful for people to grasp that point. Hypnosis cures nothing. It's what happens during hypnosis that has the potential to be therapeutic. And then it brings in a much broader base of knowledge of the literature of social psychology, the literature of clinical psychology, the literature of neuroscience, what's going on in the brains of people who are in hypnosis, and how does hypnotic experience influence those kinds of cognitive and neurological processes. It's a much deeper topic. I've spent 40 years full-time studying hypnosis and still feel like I understand this much of it. And you know, I'm mindful of what Erickson said not long before he passed away, when one of my colleagues asked him, "So Dr. Erickson, how long do you think it should take to learn hypnosis?" And Erickson paused and thought about it for a while before he said, "Well, I've been doing hypnosis now for more than 50 years. Hypnotized thousands and thousands of patients. I've written more than a dozen books and published scores of articles, and I think I'm starting to get the hang of it."
Isn't that wonderful?
And I think that really speaks to the complexity of what we're dealing with. So what is of concern to me is when people take a short course and study and then they're reading scripts to their patients as if these words are some magical incantation that have to be read in this sequence and in this way in order to get a result. So kind of a long-winded answer, but really saying that the more diverse your knowledge base, the more that you understand hypnosis and how it provides a context for teaching people things and a context for helping people associate to their resources, then you understand that you need a much broader and deeper base of knowledge to bring an effective hypnosis to the people that we work with.
Are you a believer in therapy for the therapist then?
I wouldn't suggest that it be mandated, but I think that anytime somebody moves into a field like this, it's useful to have enough self-awareness. It doesn't have to come through therapy. There are many vehicles for developing self-awareness, but it certainly helps to know yourself well enough to know that I'm good at this, I'm not so good at this, I'm comfortable with these kinds of people, I'm not so comfortable with those kinds of people. I have a great deal of empathy and compassion for this kind of a condition. I don't really get this one, and you know, to know yourself well enough to know what you're bringing to the field.
And you are a great believer in the use and application of mindfulness in therapeutic work.
I wrote a book, Mindfulness and Hypnosis, the first book on the subject, looking at some of the similarities and looking at some of the differences. And you know, mindfulness has many parallels to hypnosis, and anything really that provides people with the opportunity to develop a better focus, and anything that encourages people to get more in touch with their own internal resources, I'm for it.
Great. And you mentioned some of your books there. So for students that might be watching this film, what do you think is a good place to start with your work? What book would you recommend? If you had to pick one book, which one would you recommend?
I think the most relevant one to our discussion is trance work. Trance Work is the leading hypnosis textbook in the world. It's in its 4th edition. It's been translated into many languages. It's the only hypnosis textbook that's ever gone to a 4th edition. And it features many special segments in it, such as the frames of reference, introducing people to who the historical figures are that shape the field. But more than that, it's a very practical book that provides the skills and insights into what hypnosis is about and how to use it. It also comes with a very significant DVD of a session with a terminal cancer patient that I think really illustrates well how powerful hypnosis can be in dealing with things as vulnerable as life and death. Here's a woman who just found out that she has terminal cancer and has a short time left to live. And to watch that whole session and to see how hypnosis can be used to make an extraordinary difference at such a fragile time of life is pretty valuable learning opportunity. And the transcript to that session is also provided with commentary and analysis on the publisher's website. So it's a good book, I think, for people to get familiar with.
It's wonderful that you mention that, because many of our students, we have a very close affiliation with the hospices in Scotland, particularly Marie Curie hospices, and many of our students end up in placement, working as volunteers in their early stages of coming out from training. So that would be an excellent resource for them.
I think it would be an instructive resource for them of dealing with some pretty difficult issues.
So finally, because I know you're busy and I know you want to go over here to this fabulous conference, a bit of a rogue question. I had the very, very, very good fortune, I was blessed to meet Dr Ernest Rossi years ago, and at the end of a week's residential training with him, we got the opportunity to ask him a question, any question. So my question stayed the same, and that is, if you hadn't become a psychotherapist and a hypnotherapist, his answer, by the way, not to lead you, was that he would have kept bees and been a honey farmer, which gave us a real insight into the man. What would your answer to that question be? What would you have done?
That's an easy one, actually. A number of years ago, because of the particular skill set I have in being able to describe how people do things, I've spent much of my professional life engaging in a process I call sequencing of the steps people follow to accomplish things. And it's led me into some pretty unusual arenas. But years ago, I was invited into an elephant captive breeding program. The full story is on my website, but the lead trainer happened to have been a guy from Manchester who ran away to join the circus. But he was in charge of the elephant breeding program, which had 23 elephants. And they called me up and they said, we have 23 elephants. We want to establish a breeding herd of 120 elephants. And I said, I'm a psychologist, you must have a wrong number. They said, no, here's why we're calling. The guy who's in charge of the program is great with the elephants, but he can't really explain how he does what he does. Your ability to figure out how people do things is invaluable to us right now. Will you come out and study this guy, figure out how he does elephants, and develop the training protocols for all the new trainers and keepers we're going to need to hire if we have 120 elephants? So my first thought was, how can I do this? And my second thought was, how can I not do this? So I got involved in this program, and I actually spent the next 3 years working with elephants on a full-time basis. If you ever need your elephant trained, I'm your guy. So if I hadn't become a psychologist and doing hypnosis, I think I would have easily found my way to the world of animal conservation and working with elephants now and trying to do things to protect them from poachers. And the daily slaughter of elephants is something I would have committed to anyway. I've always been a zoological fan. But after spending 3 years working with elephants, I've always loved elephants. I'm now head over heels in love with elephants. And so if I retired tomorrow, I'd be back to elephant handling, elephant training, helping elephants, and the training to help them participate in their own care. Elephants require a lot of care. and to train people adequately to know how to provide that quality of care, and to have learned those skills myself was really extraordinary. So Ernie might be doing beekeeping, but I'd be doing elephant training. So.
Wonderful. Well, on that note, Dr Michael Yapko, thank you so much for coming to Glasgow in Scotland, and it's been an absolute pleasure to meet you. Now, I know you told me just before you came on camera that you're not a whisky drinker, but you can't leave a Scottish host without having a wee dram, so you can share this dram with someone else, even if it's not for you, but it's all the way from the island of Jura.
And I will taste, and let's see if I can get the acquired taste. Thank you so much. I really appreciate that very much.
Thank you.